and there are also people which are very sensitive. Like Professor Stoiko said, there are people highly allergic. So, and you do not know how the people will react to your product. So always the golden rule in chronic diseases is to start with very, very small dose. Make the allergy test and to make the tolerance test. Yeah? So if this dose is okay, then you can increase gradually, like going on a stairs, like this, like I'm showing you here. So you increase very slowly, and you also don't know what is the best dose for a certain patient, because there is a patient which needs a lot of propolis or a lot of pollen, and somebody which needs less, because it takes also propolis but also takes pollen, so it takes polyphenols from the pollen, does not need so much from propolis, okay? So you do not know what is the best dose for the patient, but the patient feels what is his or her best dose. So when you arrive to the best dose for the patient will tell you, oh, I feel wonderful. This dose is wonderful for me. I do not have any more pain. I do not have problems. My blood levels of this and this is in balance. So that is the best dose for the patient. Now, once you reach this best dose, you should stay in time. You should stay 1 week, 2 weeks, 3 weeks, or even 2-3 years in Lyme disease or other conditions. Stay on this dose, which is best dose for you, until the specialist, the doctor, especially, for example, in neurology, if it is a multiple sclerosis, until the specialist says, now you are healed, you are okay, you are much improved. Then you can diminish the dose, but in apitherapy, we do not go to zero with the dose, because we diminish the dose, but then we stay on a maintenance dose to prevent that the disease comes back. And this is the beauty of big products, because in the first part we use the big products as nutraceuticals, as therapeutical agents, like medicine, but then to prevent the disease, we use them as foods, mainly as food, or let's say nutraceuticals. So we can use propolis a bit, pollen a bit, honey a bit, royalty a bit, just to prevent that the disease comes back or other diseases are coming too. So this is the short explanation. But the dose, keep in mind, must be chosen together with the patient by looking to the patient, by making all kinds of analysis and tests.
Thank you. Thank you very much.
Any question?
Milligrams per meal mean in one bottle. In bottle it contains 6 milli. I can show you the bottles. It's very small like this, and also the bigger one. But the 6 milli is contains 900 milligrams of propolis. 900 milligrams of propolis. So if the body is 50 kilograms, so each kilogram needs 100 times 50 kilograms. So 150 times 50 kilograms is equal 5,000 milligrams.
So this is the entrance of our room.
50 milligrams per meal mean in one bottle. In bottle it contains 6 milli. I can show you the bottles. It's very small like this, and also the bigger one.
Will present a short review on propolis indication. He's professor in Arab University of Iran. He's beekeeper from over 10 years in Iran. Welcome, Dr. Reza.
Hello. Hello, everybody. You hear my voice?
You must turn on your microphone.
It's not on. Can you hear me? You can't hear me?
We don't hear you.
But it's on. My phone is on. You can't hear me? Can you hear me now? No? Can you hear me now?
Yes,
Yes,
hear
yes,
you now.
Yes.
Okay, thank you.
Okay, so I use my laptop microphone. Okay, hello everybody. Let's start. Let's start my presentation. And hello, Mr. Dr. Stefan, my dear professor. Okay, I open my presentation. Can you see everybody? Can you see my presentation?
yes, yes, we can see you.
It's a short video on Propolis. I am speaking starts on I as Ms. Anna said, I am one and work.
Есть три причины делания этого лечебного процесса. Первое – это акупунктура, то есть использование пчелиных жал.
Konferensi internasional tentang apiterapi atau pengobatan menggunakan produk lebah.
По особенным случаям, то есть из болезней типа коленного артрита, шрамов, болезненных точек.
Luar biasa, produk lebah ini sudah menjadi pengobatan dunia. Ini konferensi internasional yang dihadiri oleh dokter-dokter dan peneliti-peneliti produk lebah dari berbagai belahan dunia. Dahsyat.
There you go. Okay. Legends, go forward. Okay, now click it one more time. No, go back to the other side.
Produk lebah bukan hanya madu, tetapi juga ada
Right here next to the mouth reaction.
yang pertama ada bee pollen, ada juga
No,
royal
go back.
jelly, dan juga ada
Okay,
propolis,
no,
dan juga
keep going.
ada
Go past that
sengatan
page.
lebah, juga itu adalah pengobatan apiterapi.
No, keep going to the end. To the end. Keep going to the end. Keep going. To the end. There you go. Okay, these are mild reactions, a regular bee sting. Any more of a reaction than this, then I strongly suggest that they
Insya
go
Allah
get
akan diadakan konferensi internasional lagi, tapi mudah-mudahan corona sudah selesai. Insya Allah diadakan di Turki tahun depan, bulan sekitar bulan April. Jadi juga akan diundang dokter-dokter dan ilmuwan dari berbagai belahan dunia juga untuk hadir ke Turki. Dahsyat.
Okay. What I want to stress is that my people fill out an 8-page questionnaire. Oh, my apologies, Mikhail. I forgot you were there. Okay, let's go back. There you go. Now go back one, yes. Now to the end. There.
Details list. Yeah.
Yes.
Окей. Домашние средства – это Пчелиного яда выводят некоторые побочные реакции, легкие, такие как покраснение, легкий отек и жар в области укуса.
Jadi pematerinya ada dari Rusia, ada dari negara-negara lain yang kita nggak ngerti bahasanya, tapi ada penerjemahnya ya. Ini kita dengerin penjelasannya dalam bahasa Inggris.
Также крем с прополисом можно нанести на кожу. Стойка прополиса по 5-15 капель 3-4 раза в день для приема внутрь с медом и чашкой чая.
Dengar ya tadi propolis ya.
Крем против зуда с 1% гидрокортизоном нужно нанести на кожу в области укуса. Также лосьон от пчелиного укуса, который нужно смешать со 100 мл водой, 5 мл уксуса и 5 мл соли. Нанести этот раствор на пораженный участок и повторять при необходимости.
Hyaluronic acid helps to put the melatonin from the venom into the bloodstream, like immediately. And I've discovered a few years ago that hyaluronic acid has been added to our anesthesia, steroid injections, into any injected item to help that chemical to get into the bloodstream faster. But bee venom therapy can affect on a hormonal level diabetes, PCOS, beta blockers, antidepressant medication, and PTSD.
После многих годов работы она обнаружила, что
Jadi salah satu produk lebay yaitu propolis yang sangat kita syukuri itu sudah menjadi pengobatan di berbagai belahan dunia. Bahkan di negara lain itu sudah lama melakukan pengobatan menggunakan produk lebay. Ya, terutama propolis, karena di propolis telah banyak mengandung zat-zat yang bersifat farmakologis atau bersifat obat. Kita bersyukur ada penelitian dari berbagai belahan dunia membuat kita semakin yakin bahwa produk ini bukan hanya testimoni semata, tetapi juga didukung oleh penelitian ilmiah, praklinis dan klinis. Itu dari berbagai belahan dunia.
And twice I found out that the medications that they were taking, a couple were contraindicated.
Этот процесс также психологически тоже помогает и наносит гигантское лечение человеку также при плане эмоциональных проблем.
And I never, ever seen one without an EpiPen available.
Sorry, could you repeat?
I've never, ever seen anyone without an EpiPen available.
И она никогда не проходила процесс укусов с ручкой этой специальной, которую это проводится.
That's the end of my lecture, and Mikhail, you did a nice job. Thank you.
Thank you.
Thank you very much, Lady Sareli. We had a free presentation from United States. So I think we can go over to the discussion. And we start discussion now. We have one question, the first question from Grace Asiko. Can I connect with Grace?
Hello.
Hello.
Yes. My question is on the venom, the last presenter, and the previous presenter also. In as much as the bee venom is used to treat a lot of ailments like arthritis and many other ailments, you find the negative effect coming in, so that the people with the phobia for bees do not embrace bee sting therapy. And at the same time, there are people who are allergic. In previous presentation, it was stated that allergy is not as a result of the bee sting, but from the lady's presentation, she has no problem with the allergy. She has no problem with the allergy. So what is your take in that? The negative effect of the bee stings and the people who have the phobia already. How do we balance this nice apitherapy using the bee sting between the people who are allergic and those who are not allergic, and also the torturer? You know, I see as if it's torture if you use the stings to sting somebody for a long time. Isn't there a neutralizer, like in the current medicine? There is a neutralizer you used to give Panadol together with aspirin or something like that to match, so that you don't feel so much pain. So far, is there something that can be given together with the toxin, so that the patient doesn't feel?
Grace, I can answer this from our point of view, and I'm sure Lady Shirley had her own point of view, but we use a slight amount of lidocaine added to the injections before we do it. So there is lidocaine in the injection. We also start the skin test, and we escalate the dose from 2 injections to 4 to 6 over about 6 weeks. So they're not given the maximum dose, which is 15 injections the first time they see us. And we had very few dropouts. There were a few patients dropped out. They couldn't handle the bee stings, even with the lidocaine in it. But the lidocaine is a common additive to our injections.
It's great.
Okay, now for me, I test them first with bee pollen. If they can ingest a teaspoon to a tablespoon of bee pollen, they're not going to have any allergies to bee stings. If they already know that they're not allergic, then I will go ahead with the program. As I understand it, doctor, from your point of view, you're actually creating a desensitization program by giving this a little bit at a time and letting the body build up the immunity, correct? That's what it sounds like.
That's sort of correct. Every patient's different.
Yes.
We screened for the osteoarthritis trial. We screened about 800 patients. We accepted 400 into the study. So about one to one patients either taking other drugs.
Insya Allah, besok jam 11 Bapak Profesor Al-Mahdi, guru besar kita, akan diundang untuk melakukan presentasi juga di konferensi ini. Dan ini sangat kita syukuri karena wakil dari Melia Sejahtera, dia guru besar kita, mewakili Melia Sejahtera dan mewakili Indonesia, mewakili Universitas Andalas Padang untuk presentasi di konferensi internasional tentang apiterapi, produk-produk perlebahan untuk pengobatan secara ilmiah. Nantikan besok presentasi Bapak Prof. Al-Mahdi jam 11 waktu Indonesia Barat. Insya Allah kita akan siaran langsung juga. Beri dukungan untuk guru besar kita Bapak Profesor Al-Mahdi. Yeay!
I'm very, very careful. 3 days prior to my appointment with my patient, I can tell you how long she sleeps, what she's eating, how she passes gas. I can tell you everything. And no one leaves my table at least an hour after they have their sticks. And I've not had any issues. And you're right. Many of them follow through the program because of the pain. It is long. And they take acetaminophen for that. And ibuprofen is not recommended. But it is quite painful. I used to sting in my lower part of my spine before I had spinal surgery. And they kept me walking. It's painful. But after a while, if a person is strong enough, they become acclimated to the pain and flow. Does that answer your question?
Thank you. Thank you so much.
Do you have any question to Lady Serali? Or to Dr. Brooks, to others? On that, we have a new question. Lady, have you experienced of any of the Lyme yourself?
No. No, thank God.
Next question is to artificially? Will the bees die?
The newer technologies use a piece of material that the bees can push the virus out without losing it. Because sting tips into venom were a problem in the 60s and 70s, and we've eliminated that. But we don't have control over how the venom is collected. It's collected by Apico Incorporated. They're a Vermont company. They produce all the venom for allergenic use, and they have their own SOPs and their own drug master file at FDA. And to develop a drug master file costs about $1 million, so it's not something every beekeeper is going to do or use. But I saw a lot of venom in different parts of the world was highly contaminated with everything from regurgitated honey to feces from the bee, depending on how it's collected. And this process that they're using, that Apico uses, is they're collecting a pharmaceutical grade product. And it's tested in FDA, and actually the European Union goes to their site every 2 years and does an inspection. So it does have a certificate of compliance from the EU.
I didn't know that. I just know that here in the States they use the
Internasional Conference Apitherapy Internasional dari berbagai belahan dunia. Berkumpul di sini dokter-dokter dan peneliti propolis dari berbagai belahan dunia, peneliti lebah ya, produk-produk lebah bukan hanya propolis tapi madu, royal jelly di Poland dan fenom lebah atau sengatan lebah.
We don't have anything to do with the collecting itself. But you mentioned Charlie Mraz. Charlie Mraz was the first person that started this company, and now his grandson, Charlie Mraz, I guess the third, is the owner of the company.
That's impressive. As I understand it,
Charlie, he was a friend for 20 years.
Wow. Well, as I understand it, there was a doctor from Morocco.
Sangat beruntung dan bersyukur bisa mengikuti konferensi ini. Semakin bersemangat menjalankan sosialisasi tentang produk lebah di masyarakat, karena bukan hanya testimoni yang banyak tetapi juga penelitian ilmiah praklinis sudah tersebar dari berbagai belahan dunia. Jadi kita semakin yakin dengan khasiatnya. Waalaikumsalam, Mbak Nuri Humairo. Silakan, boleh apa pertanyaannya?
Small world.
Yep, sure is.
Thank you. We have the next question to Lady Sarali. You can use ice to cool and diminish for multiple sclerosis patients together with therapy or common drugs like
Mbak Nuri Humairo, silakan DM aja ya, karena saya mau akhiri siaran langsungnya. Silakan di DM aja pertanyaannya ya. Oke, terima kasih. Assalamualaikum. Oke, besok kita online lagi, kita siaran langsung karena Bapak Profesor Almadi insya Allah akan mengisi presentasi di konferensi ini. Kita dengarkan bersama siaran langsungnya. Terima kasih, Assalamualaikum.